Have you ever prayed but never got an answer, and wondered if God was really there? Did you feel all hope was gone, but in His time He came along and answered the prayer you thought was gone? There is no prayer too small, for God hears them all. The answer may not be just what you want, but He always knows what's right, even when we think it's wrong. Just remember, there is no prayer too small. I have read, if you will ask, you shall receive. No matter what it is, I still believe. There is no prayer too small, and even when we fall, He gives us just exactly what we need. There is no prayer too small, for God hears them all. The answer may not be just what you want, but He always knows what's right, even when we think it's wrong. Just remember, there is no prayer too small. No prayer too small. He always knows what's right. God hears them all. There is no prayer too small. My God hears them all. The answer may not be just what you want, but He always knows what's right, even when we think it's wrong. Just remember, there is no prayer too small. No prayer too small. No prayer too small. God hears them all.
Hello, my name is Ralf Friedrichs. I'm an addiction recovery coach and the host of the Take Your Life Back Today show. As an addiction recovery coach, I want to share something with you. Let me be crystal clear to leave an everlasting impact. Just imagine being buried alive. You're in a coffin, but you know you're not dead. You don't know how to get out of that coffin. You tried lifting the lid, but the enormous weight upon the lid prevents you from opening that lid. You tried banging on the lid to maybe unsettle the dirt. Someone might start digging their way down to helping you. This is what it's like to feel at the lowest point of alcohol and drug addiction. You know you need help. You know you can't do it on your own, but you don't know where to go. In reality, there are people probably standing right by your side. You just don't know that. right by your grave, I should say. You just don't know that. You just think you're going to die. Usually, though, people don't think about death when they're habitually abusing drugs and alcohol. In order to feed an addiction, you have to be great at repressing the fear of death. I often ask you, my audience, did it ever cross your mind while you're abusing drugs and alcohol that maybe, just maybe, you might overdose and take something away that God had given you, called life? With this, let me leave one last thought. Don't be like the person that I just talked about that went to their grave without seeking help. Instead, pick up the phone and call me at 844-405-HELP, and I promise you I'll help you take your life back. For your life is God. Take your slippers off at night and put them by the edge. Don't put them by the edge of your bed. Stick them under your bed. That way in the morning you'll be forced to drop to your knees and retrieve those slippers. And while you're on your knees, that's the time you should be talking to God. Ask God for guidance and direction, forgiveness and mercy, and to thank Him for having a home, clothing, food, relationship, and your health. Ask God to guide and protect you each and every day, 24/7, 365 days a year. Pray for the people that are around you that might not know how to have that personal relationship with God. Now put those slippers on and walk with God 24/7. Folks, Mail, K-N-E-E, mail. It's your personal communication line each and every morning between you and God. Let's talk about 8 signs that are showing that maybe you are just way too stressed out in life. Unless you surround yourself with Tibetan monks, chances are you're hard pressed to find someone in your life, including you, that wouldn't say that they are stressed about something in their life. And while stress can sometimes be good, it can help you conquer fears or motivate you to get something done. When you're constantly in a state of tension and anxiety, it can have an effect on your body's physical and emotional state. In fact, the Centers for Disease Control Prevention, let's put this right here, says that 90% of all disease is stress-related. So, what's the best way you can get a handle on your stress levels? Well, help you identify 8 red flags that you need to relax a bit more, and how to do it is what I'm going to talk about today. Number 1 is you're perpetually sick and just can't seem to get over it. It seems like every week you've got a cough, a sore, maybe a sore throat, or a fever. You might want to blame your workload, or maybe just sneezing from a coworker. When we are under extreme pressure, our bodies secrete a stress hormone called cortisol that can help us in the short term, says Richard Colgan, MD, Professor of Family Community Medicine at University of Maryland School of Medicine. Also, the author of Advice and Healer. But if you're stressed out constantly, these hormones aren't as helpful as they can become depleted over time, says Dr. Colgan. Cortisol and other hormones are components of the immune system, and though they help the body cope with stress, when these hormones are withdrawn, we become more susceptible to sicknesses. And the side effects don't end there. Stress can also slow down wound healing, causing sores, contribute to the reactivation of latent viruses, and increase vulnerability to viral infections, says Carrie Tuitt, clinical psychologist at Yale University. So what to do? Listen to your body when you feel tired or drained, and make time to rest. Get some extra sleep. Whether you recently spent time traveling, finalizing a huge work project, or just had a lot of late dinner meetings all week, allow your body the time it needs to recover. A tired body is not well prepared to cope with stressful situations and ward off illnesses. Number 2, you're having trouble concentrating. When you're too overwhelmed to focus on what's in front of you, or you can't remember simple things like a coworker's name, it could be a sign you're overworked. Research has connected long-term exposure to excessive amounts of cortisol to shrinking of the hippocampus, the brain's memory center, says Tuitt. Studies have shown that long-term stress stimulates growth of proteins that might cause Alzheimer's disease. So what should you do? If you find that you're experiencing this during your workday, taking a few long inhales and exhales can help when faced with high-pressure situations. Deep, even breathing not only affects whether our thoughts control us or we control them, but it also affects the bodily sensations that experience when faced with a high-stress situation, says to it. This time of breath, or I should say this time of breathing, can help control the heart rate and blood flow, as well as muscle tension, she says. Number 3, you have constant headaches that just won't ever go away. If you're experiencing throbbing or feel pressure anywhere in the head or temple area, there's a good chance it's tension or stress headache, says Dr. Colgan. Oftentimes, people point to the particular troubles in their life that might be causing these pains, but lifestyle might be to blame instead. Keep in mind now, listen, if your head pain feels like a migraine headache, the worst headache of your life, or a headache that awakens you from a sleep, those are signs of dangerous health problems, and you should immediately visit a doctor, says Dr. Colgan. What to do? When stress is the cause of your headaches, the easiest thing to do is have less stress in your life. But that advice itself is stressful, says Dr. Colgan. Knowing what your headaches are coming from is a helpful therapy. People oftentimes feel worse worrying and trying to figure out what the cause could be. So knowing it's not some serious health problem may make a person feel better. Sometimes the most effective way a doctor can treat a patient is to teach them about their symptoms, says Dr. Colgan. Number 4, your back or neck is always aching. If you have knots in your shoulders or a stiff neck or lower back cramped up for a long day of work, it could be a constant of a job or personal situation, not just a position you sit in during the day. High levels of stress and tension create discomfort and muscle pain by tightening muscles and causing muscle spasms, says Dr. Colgan. And stiff muscles in your neck can also lead to headaches, he says. So what should you do? If your back pain developed after an accident or emotional trauma, it could also be a sign of post-traumatic stress disorder, otherwise known as PTSD. The National Institute of Health recommends talking to your primary doctor, as well as people aren't able to heal their back pain until their emotional stress is gone. So what you should continue to do is relax techniques that can help with stress reduction, including guided imagery, taking deep breaths from the diaphragm, and meditation, massages, and yoga, says to it. Try devoting time for stretching breaks throughout the day to help prevent muscles from tightening up, and make time for some of these yoga poses to unwind the end of the day. Number 5, you're having trouble sleeping as well. If you find yourself waking up and worrying or ruminating over things, it could be a sign of anxiety or depression, says Dr. Colgan. After a long day, sleep should come easy, and getting into your bed finally be bedtime. You can shut your brain off and relax. If you feel tired but have a difficult time falling asleep, it's possible you have stress-related fatigue. What should you do about that? Talk to your doctor. Ask if this is a regular, or the doctor might ask you, is this a regular occurrence, and discuss whether your chronic stress may have led you to, I hate to say this, but maybe even depression, says Dr. Colgan. When you're not sleeping well, everyday annoyances might make you feel even more overwhelmed and frustrated because you are more vulnerable. A tired body is not well prepared to cope with stressful situations and ward off illnesses, says to it. She suggests addressing your sleep issues by asking yourself if you're getting 6 to or more hours of sleep each and every night, and if not, determine what's interfering with that pattern. Cutting back on caffeinated and alcoholic beverages and increasing exercise can also improve sleep patterns, so start working on it. Number 6, your hair is starting to fall out. If you're waking up with more than few strands on your pillow, you may be suffering from a medical condition called alopecia acreta. This is an autoimmune skin disease brought on when a body's immune system attacks the hair follicles, causing small round patches of hair loss and from that to separate from your scalp. It is not dangerous, but it's likely to be associated with severe stressor, like an assault or significant trauma events in one's life, says Dr. Colgan. This disease more likely is to happen in a young woman or adolescent girls. So what should you do about it if you're one of them? In most cases, this is typically a temporary condition, and your hair will grow back once stressed is minimized. But don't be afraid to talk to your doctor about what's going on, says Dr. Colgan. While your doctor might recommend injectable scalp steroids to help the hair growth, it's best to have an examination, as the hair loss could possibly be a sign of scalp fungal infection, a bacterial function, or even a thyroid disorder. Number 7, you're getting UTIs. If you've ever been in a meeting that dragged on for hours and you're so focused on an assignment that you didn't even get up from your desk for a bathroom break, you could be putting yourself at risk for urinary tract infection, says Dr. Colgan. When people are under increased stress or working too hard, they sometimes put off going to the bathroom. But that's one of the biggest risk factors for a UTI, says Dr. Colgan, who's also a UTI expert. What to do? Come on, you're an adult. Get to the bathroom when you have to. When you feel the urge, go to the bathroom. Give yourself permission to take a break and go. An uncomfortable urinary infection is going to feel a lot worse than those few times or the few minutes you might spend trying to go to work and getting away from your schedule. Number 8, your sex life is suffering. While you and your partner might not be aware of it, stress and tension are leading causes of erectile dysfunction. A lot of men walk into my office and say they want Viagra, but oftentimes I'll tell them I don't think the pill will help their problem, when I believe it's stress that's causing the issue. Says Dr. Colgan, it's a vicious cycle, as erectile dysfunction can also cause more stress for the person experiencing it, and since they're stressed, sometimes guys will start drinking alcohol and reduce their inhibitions, but I will remind them that this is a muscle relaxer, so don't start drinking because it won't help you. It will just relax the muscles. What to do? Identify what's causing the problem. That's the first thing you should really do. I tell patients the body and the mind are like significant others. When one doesn't feel well, the other one sympathizes, says Dr. Colgan. If you're having a rocky relationship, increased financial stresses, or lost your job, it's illogical to think that with all worry and tension in your life, your body is going to stand by idly and not act differently. Dr. Colgan also recommends talking with your partner to let them know what's going on in order to work through their problems. I tell them the answer isn't a pill. The solution is for you and your partner to communicate so you can help them understand what you're under. And maybe let them understand that you're under a lot of stress and tension right now. If you can work to relieve that tension, your sex life will improve as well. These are all the things, 8 of them, that are signs that you are stressed. Breathe in. Breathe out. Let the stress drip away today. Let the stress leave. And one de-stressor, I promise you in life, is your personal relationship with God. So start today. I hope to God you enjoyed this show, and I hope and I pray that you'll call me if you need any help whatsoever at 844-405-HELP, and I promise I'll help you take your life back. Take care. May God bless you.
Have you ever prayed but never got an answer, and wondered if God was really there? Did you feel all hope was gone, but in His time He came along and answered the prayer you thought was gone? There is no prayer too small, for God hears them all. The answer may not be just what you want, but He always knows what's right, even when we think it's wrong. Just remember, there is no prayer too small. I have a ready few, will ask, you shall receive. No matter what it is, I still believe. There is no prayer too small, and even when we fall, He gives us just exactly what we need. There is no prayer too small, for God hears them all. The answer may not be just what you want, but He always knows what's right, even when we think it's wrong. Just remember, there is no prayer too small. No prayer too small. He always knows what's right. God hears them all. There is no prayer too small. My God hears them all. The answer may not be just what you want, but He always knows what's right, even when we think it's wrong. Just remember,